appreciated the comments offered by Dr. Robertson, and I think he, again, gave us a great framework and backdrop for our discussions here today. There were a couple of things that I think were worth summarizing. One, he spoke about where we are as a state in terms of efforts that are going on nationwide, and at best, we're in the middle of the pack, which in and of itself should be a strong, strong incentive for us to pick up the pace of our work. Secondly, is that in order to make a difference, we must seriously address equity. This work will not be done in the way that it's intended unless racial, cultural, and rural communities around the state begin to see the quality of their lives transformed by the efforts that can extend from this focus today. He also talked about two driving strategies. One is changing the context and removing barriers to healthy choices, and to make that easier both within industries and communities. And the second was strengthening the efforts around collective impact so that when this work is done by many, it has the opportunity of impacting the greatest number possible. We have a number of panels who will help us to look a little deeper into each of these areas of strategy, and I'm pleased to introduce our first panel, which is looking at changing the context within communities. We've got a number of people from across the state, and I'm going to read through a little snippet of the bio of each and then introduce our moderator. Our first panelist is Bianca Fernandez, who is a community health worker and program manager at Nextdoor, Inc., and she'll be speaking about the work of their community health team. Bianca, if I can just get you guys to raise your hand. The second is Paul Stewart, who is CEO of Sky Lakes Medical Center, and he'll be speaking about the Blue Zones project in Klamath Falls. Our third presenter is Sandra Slattery. Sandra, not Sandra. Sandra, wonderful. And she is Executive Director of the Ashland Chamber of Commerce, and she'll be talking about the Blue Zones project there in Ashland. And our final presenter is Alan De La Torre. Did I get it right? Wow, my Brooklyn upbringing. And Alan is the research associate for the Institute of Aging at Portland State University, and he'll be speaking about age-friendly efforts in Portland and Multnomah County. And our moderator, I'm privileged to introduce, is Dr. Ed Ray, who is president of Oregon State University. In his 13th year, Dr. Ray has led Oregon State through a major period of transformation to become an internationally recognized public research university. Under his leadership, OSU has completed and updated a visionary campus-wide strategic plan that has served as the framework for Oregon State's development in profound and historic ways. Please join me in welcoming OSU President Ray.
Well, I managed to get out of the chair, so that was my fourth or fifth yoga exercise. Good morning. It's wonderful to be here with all of you. Mike mentioned our strategic plan at Oregon State University. One of our three signature areas is improving human health and wellness. I could go on about it, but I'm actually, like you, more interested in hearing from our wonderful panelists about the incredible programs that they're undertaking and how those are working out. Hopefully there are lessons to be learned for all of us. Two of the areas that I'm proud of that we work with, obviously, are the statewide public services, the extension program, which reaches into every county and corner of the state, bringing information about family matters, about nutrition, education to every part of the state. And now our College of Public Health and Human Sciences, we have an accredited School of Public Health. They're going to be partnering with the Extension Service to try to bring public health support services to all of the rural communities throughout the state. So I think there are lessons there for us to gather from our partners here about the incredible work that they're doing. And so I really want to move on to asking them to answer a few questions. So what I'll do is I'll ask a question, call on one of our panelists to give a brief answer, and then each of the four will have a chance. I've got three, and there's a bonus question if we can be brief and to the point. And I know that people here are very passionate and very excited about what they do, but if we can keep it brief, that would be good. One of the things I love about Oregon Healthiest State, the program that we're all part of here today, is, you know, I'm a New York guy too, who's been here now for a little over 12 years, and I've observed that Oregonians are a lot better about talking about things than they are about doing things. And so it's really nice to be in a community that's actually doing things and things that we can learn from and take back with us. So let me start with Bianca. The first question is, what problems are you trying to solve, and how would you measure success?
That's a good one. So I am representing the community health team, which is based out of Hood River, the Dalles Gorge, Columbia Gorge area. And our main focus is to look at like high ER utilization, and that's how it started. It eventually started to encompass patients who were labeled or termed like the top 200 utilizers for a particular CCO, Pacific Source, and kind of delving in really deep into very like one-on-one interactions with these patients to figure out what are the barriers that are in place that are keeping you from being able to be healthier holistically. And initially, you know, Pacific Source wanted us to measure success with like a tracking sheet, monitoring how often we would make contact with patients, providers, other agencies. And then we started to realize that we can't measure success that way, at least not with this kind of outlier population. So we started measuring success more as, can we identify what the barriers are? Can we like fill the gap that exists there? And if we can't connect patients to those resources, what's keeping us from that? Is it that the resources don't exist, or is it, you know, some other systematic barriers that are in place? So,
Paul?
Well, our journey started really about 4 years ago. We collaborated with the Public Health Department and our local Medicaid health plan to do a community health needs assessment. And that needs assessment sort of validated what we knew already. Klamath County is not very well from a health standpoint. In fact, the Robert Wood Johnson County rankings put out by the University of Wisconsin Population Health Institute has Klamath County down in the bottom of all Oregon counties. And the community health needs assessment kind of helped highlight what some of the key issues are that are dragging us down. Clearly, we have obesity issues, tobacco problems, alcohol and substance abuse, but we also have a lot of socioeconomic determinants of health that are a problem. High rates of teenage pregnancy, low rates of high school graduation, low birth weight infants. And so the Public Health Department in our community shepherded developing a process called Healthy Klamath. And it was really a collaboration of business, healthcare providers, social service agencies, the schools, really great representation from across the community that came together to start to talk about what our priorities would be. Long story short, we're focusing in, I think, on obesity and the chronic diseases that people are at risk for when you have a high body mass index. We're working on tobacco. We're focused on high school graduation rates. And then we're focused on economic development as a determinant of health to try and spur more growth in the community that will enable people to lift themselves up out of poverty. We have too many children living in poverty. And so those are sort of the key areas that we're focusing on, the problems we're trying to solve.
Sandra?
Thank you. One of the roles of the Ashland Chamber is to provide education for our businesses, and particularly on problems and challenges that they're experiencing. Our chamber is a convener and a connector for community conversation and collaboration. About 25 years ago, we formed a group called the Ashland Coalition, and it's made up of businesses, the City of Ashland, Southern Oregon University, the Oregon Shakespeare Festival, the school system, and our hospital, Asante Ashland Community Hospital. We felt that the health and wellness effort was a natural extension of this ongoing partnership because health care for businesses and our employees is always one of the areas that have been identified as a challenge, and clearly it was a growing problem. 2 years ago, we formed a small task force to discuss the health and wellness challenges facing our business sector, and they identified the rising costs of healthcare, lack of access, both physical and mental health, and the inability and frustration of really how to find help, what to do about it. Our business owners are small, and they had the desire to provide care for their employees, but they didn't know how to break through the challenges that they were faced, so they looked to us for help. And they recognized, as we did, that it wasn't just the employee, but many times it had to do with caring for a child or an adult. There were financial, emotional stresses as well, and all of these began to adversely affect employee productivity and retention. So as we began to research and find data, we found out there was a significant lack of data because our businesses are so small. So our first intent is to find out information, find out what the true needs are, and that's the stage we're at this moment in time.
That's very good. Alan?
So the issue or the problem that we're working toward resolving is creating communities that are age-friendly or friendly for people of all ages and abilities. And in 2006, the Institute on Aging joined a World Health Organization project on age-friendly cities, where we were able to really identify the day-to-day experiences of older adults in the city of Portland. And I remember in March of 2007, when we were sharing our findings with our global partners in London, the director of the Life Course program said, now, over the next year, go back and implement your findings. And as a graduate student at the time, I raised my hand very meekly and said, this is my life's work, not the work of a year, and I'm wondering how we're supposed to get this done. And they just sent us back into the community and said, do your best, go out there. In 2010, we started to see what was an emergence of a larger global movement around age-friendly communities. And really, population aging is driving this. We're in the midst of the rapid and unprecedented aging of our population. So we were able to join what was a WHO global network on age-friendly communities. Later, AARP began coordinating the US effort. And here, locally, our initiative has expanded from just the city of Portland to Multnomah County in 2014. And increasingly, we're starting to understand that partnerships are key to success. We're looking at data partnerships to measure success with statewide organizations, and also looking to partner more closely with our local municipalities to start measuring success. We've got issues in front of us that pertain to the physical environment, to the social environment, and to the service environment. On a personal level, I'm a very strong advocate of accessible housing, and we've been building what one person calls Peter Pan housing for essentially the entire time that we've been out. Building homes in our communities, housing that is good for people who will never grow old. So how do we start reshaping that concept? How do we start looking at the issue of, rather than the silver tsunami, the silver reservoir, which is a growing resource in our communities, and figuring out ways to properly measure what successes are, from process outcomes like increased awareness and partnerships to more measurable outcomes, such as improving that ranking of 41st, which would be pretty low, with purpose and meaning, which is critically important for older adults.
Well, thank you. That's really interesting, and it's clear you're working on very complex, very multivariate problems. But I'm just curious if maybe one or two of you might mention, could you give us one specific goal, say in the next 5 years, 10 years, that you could cite that if you could achieve that, you'd be thinking, aha, it's working, we're getting this right. Any volunteers? Just one or two things.
Yeah, it's an easy one for us. And again, the one that we are really focusing on is decreasing body mass index. It's obesity. And
so you'll have a big weigh-in or something?
Well, we've started with our own employees at Sky Lakes Medical Center, being the largest employer, hoping that that'll create both a platform and results that will speak for themselves, but also a critical mass, so to speak, no pun intended, in our community to move that venture forward. And, you know, having been in healthcare for a long time, I'm really starting to give up on changing the behavior of adults. But if I could see the rate of childhood obesity go down over the next 5 years in our community, that would be a home run.
Good, good. Maybe any other, or we can move on to the next question. Why don't we move on? Because I know you're at different stages. Some of you were indicating, Sandra, that you're getting the data and it's so important to know the facts on the ground. I mean, how do you know you're making progress? How do you certify it if you don't know where you started from? So that's got to be the first place for everybody to start. So let me go to the second question. Paul, since you just spoke, I'll ask you to be first to go on that. And that is, what's the framework that you're using, and what partners do you have involved that are helping you move toward your objectives?
So I mentioned the Healthy Klamath collaborative that came together, and this has just been a group of incredibly passionate and committed individuals from all aspects of our community. We have representatives from the Klamath tribe, public health department, other social service agencies, all of the city and county schools, et cetera. But the group, I think, floundered a little bit for lack of focus, if you will. And several years ago, I made probably one of the best decisions I've ever personally made, I'll brag about, and that was hiring Dr. Stephanie Van Dyke and Catherine Pope to come to our community to start a wellness center. And the wellness center that they've started is specifically focused on behavior modification to reduce the risk of chronic disease from obesity. And those two individuals sort of became part of the passion and driving force behind the Healthy Klamath group. But again, we struggled. We lacked focus, and we were having a hard time really putting that framework and infrastructure together. And we became aware of the Blue Zones. And this is back about 2 or 3 years ago now, and we approached the Blue Zones directly and had conversations with Tony Butner and others of the Blue Zone staff about would they be willing to come to Klamath and do their work. And long story short there, we just didn't find ourselves in a position to be able to do it by ourselves. But fortuitously, that was about the same time the Oregon Healthiest State Initiative kicked off and provided the platform to bring the Blue Zones folks to Oregon. And as you know, we had a huge contingent here last year kind of petitioning that we really wanted to be on the forefront of that initiative, and fortunately we're selected to be the pilot county. So we now have 5 excellent full-time Blue Zones project staff. We have 12 or 13 different domains that have volunteer committees that are working on identifying from a data perspective, what are the priorities? Where are the opportunities? And we're going through a very collaborative process of identifying those priorities and the metrics that will be used to measure our success. And by the end of December, we'll have a very concrete blueprint for what we hope to accomplish in each one of those areas, a committee structure that will guide it of volunteers from throughout the community, and the metrics that we'll be measuring to monitor our progress going forward. And all of that will be supported by the 5 full-time Blue Zones project staff who are doing the boots on the ground work. So we're finally at that point where we really do have a great framework to move this initiative forward in our community.
Great, thank you. Sandra?
It's very exciting to hear what Klamath Falls is doing. We brought a small but hearty group up last year and in the weather, and that was the first time we'd really heard about Blue Zones. And we're impressed by the turnout from Klamath and really learned all about it at that particular conference. And we were excited because we recognized that it would provide a logical template for us to guide us on our journey for creating better health. And so we went back and we expanded our team. And in addition to Asante Ashland Community Hospital, we brought in the school district and the Oregon Shakespeare Festival and the city of Ashland. And we began to have larger conversations around what we could do collectively. And the Blue Zones just kept coming back as something that would really match the needs that we were hearing from our businesses, that they were deeper, more complex issues that really address the whole person, which we recognize is what we were hearing from our businesses, deeper health-related issues of mind, body, and spirit. So it very much resonated with our community and something that we are excited to be able to proceed with going forward.
Good, thank you. Alan?
With respect to frameworks, we've been working with the World Health Organization's active aging framework, and it has a lot of similarities to what would be social determinants of health. So we understand that the health components of age-friendly communities should be front and center. We've been working closely with AARP as the U.S. kind of coordinator of age-friendly initiatives as well, and their Lifelong Communities Initiative really works toward, or Livable Communities Initiative really works toward many of the same goals. And as far as partnerships go, AARP has been critical both locally, the state chapter, and nationally in helping us to understand and develop indicators. Other groups such as Elders in Action, which is a nonprofit that really has boots on the ground. They have an age-friendly business program. They have advocacy efforts underway. And then increasingly partnering with government, both local city, county, and even metro now has become more and more interested in equity approaches and how do we understand, maybe from a life course perspective, what cumulative life disadvantage might look like. So when we have problems at the early stages of life, how that affects us when we get older as well. So as a gerontologist, it's quite interesting because I've been trained to study aging, older adults, and I've been opened up to think a little bit more about how do we include youth? What do we think about midlife as an opportunity for engaging and creating better health outcomes across the life course?
That's very good. Bianca?
So for our community health team, the framework, the system that we thought would be really useful is to obviously have people from different backgrounds. So we have a social worker, an RN, a nurse, and community health workers working in conjunction together as a team to go into people's homes, people that have been referred to us and are welcoming us to come in. And we go in and try to get kind of like a snapshot, their story in a sense of what's gotten them to where they are right now. And I do want to put a little bit of emphasis. I think the community health worker component of it is also really wonderful. Having folks from the target community there kind of as representatives almost, and that connection with the medical system has been really powerful. And so that's just our immediate team. And then we kind of branch out, obviously, and reach out to the providers who referred patients on to us and kind of give them a snapshot of what we saw, what are some of the concerns we have. And maybe medical concerns aren't on the forefront. Perhaps the bigger need is, they're food insecure, or their housing is really unstable, and, they're moving from one place to another, there's just no housing available. So these other really complex issues are really the first things we need to address before we can even get to chronic disease management, or whatever the clinic thinks is most important, which is, but with this particular population, we're noticing there needs to be a much more holistic view. And we've been really supported. So Pacific Source, Providence, Hood River, Mid-Columbia Medical Center, COIPA, and I'm forgetting someone else. And actually One Community Health, which is a local FQHC in the area. They've been supportive of our efforts. And in addition to that, we are able to distill what we're learning from our patients, and from an advocacy perspective, are able to bring it to what we call the SIT team, which is short for Systems Implementations Team. And these are folks that are coming from Pacific Source, from the health department, from all different agencies in Hood River, Wasco County. They sit at this table and we discuss, this is what we're seeing with our patients. Before we can get to this issue, we need to address this. And housing, mental health, all these things are coming to the table. So at least there's a little bit more attention placed on that as well.
Thank you, good. Sandra, maybe you could take our third question. And I know you're at different stages, so you have different examples that you may be able to give, but just maybe tell us what's working, what's not working. Do you have some successes? Do you have some challenges you're wrestling with?
Sure. I think what's working is our partnership. The fact that we have such a collaborative spirit within our key leaders in our organizations, and the fact that we have, while we're a small town of 22,000 people, we have 800 businesses that are members of the chamber. And so that represents thousands of employees, along with the key organizations. And so as we're taught, we knew that we needed to develop a survey. We all got together within our Health and Wellness Committee and said, well, what do we want to know? And we want to know everything. So how do we distill that down into something that we can actually take action on? And so it was very beneficial to talk through what those needs are and how we could create the questions to ask our business owners, the employees, citizens, what they think of their health, what they think of their community, where are the challenges. So we spent a lot of time working on that. And then also identifying businesses within the sectors that we feel would really take the time to talk with their employees, get the data that we're looking for, and then also likely engage in whatever initiatives we would bring forth so that we could have a group of people that we knew would provide us the information that we need so desperately. And the goal really would be that we want to provide strategic insight into our businesses and our employees. We think we all know, but we really don't. And that's what we found out when we met with the small groups, that there were so many more issues than we had recognized on the surface. Our challenge is, we created the survey without any model, without any template. Certainly by having blue zones and having something that can help guide us would be more efficient, expeditious. It would get us to our goal much sooner, because there definitely is energy and excitement and enthusiasm over moving forward with this health and wellness initiative. But we need our challenge is that we need some assistance. We definitely have the motivation and we have the interest. And we're just grateful. We're grateful that the state of Oregon chose to have the Oregon Healthiest State and partnered with Blue Zones, because who knew a year ago that we'd be down this path, and we're very fortunate and grateful for that opportunity.
Good, thank
you.
Alan, how about you?
I'll try to be brief here. I'd say that our biggest success is that we've really increased awareness about aging issues and disability issues, and we've continued to persevere even though there hasn't been a tremendous amount of funding that we've been able to come into. We've pushed forward. We've created new partnerships, and we've been able to, with a group of very dedicated volunteers and organizations who are committed to seeing aging an issue that's perpetuated and continuing to be in public light. Really important. One major success that we've had is on the policy side of things. So through the Portland Plan and now the Comprehensive Plan, we have some of our first aging-related policies in the city of Portland. Policies around aging in place and universal design. I remember sitting at it was a Planning and Sustainability Commission hearing, and we had worked with our advocates in the disability community to literally put paper sacks over our head while a person was speaking to say, we remain an invisible community. And that shook the room. And actually people said, you know what, maybe we are forgetting about the issues of aging and disability enough that we got policy in place. And so sometimes you need somewhat extreme acts to get a victory on the ground. But some of our challenges, and I have to be honest, we've been pushing for what is a collective impact model, not with the funding that's necessary to really get that going, but now realizing that we need to join collective impact, not as a backbone organization that's leading the push, but to join forces with public health, to join forces with state efforts, and to really understand how we can build synergies, both as a leader but also as a partner to get us to our ultimate goals, which are pretty simply to improve the quality of life and well-being of people of all ages and abilities.
Thank you. Bianca?
So I think our biggest success has been just the relationships, although it sounds a little corny. I think there's a lot of power in that connection and that ability to establish relationships with people who have been on the fringes and have been ignored or that have been kind of like thrown aside by the systems that theoretically should be there to help them. And I have seen some wonderful transformations, not too many, but a handful of folks who have started to become better advocates for themselves. So kind of by modeling what healthy interactions could look like, what it looks like to maybe make a phone call and ask for something or request something. They've been able to do that for themselves as well, and have just like, it's just been wonderful to see some of those transformations. And then the challenges are many, obviously. Like this kind of work isn't done a whole lot. And a lot of the data we see just kind of looks a little bit like chaos. So I think one of the challenges we have is maybe like trying to figure out what's the best way to track success that could be shown quantitatively as well. Because we're seeing it on the ground, it's just making those numbers show it as well. And then, you know, funding, as always, is kind of one of our barriers. But it seems like the community health team will be, our goal is to have it shift into a clinical sphere so that there's still a lot of like outreach work, but it would exist within the clinic with like the electronic medical record, with the ability to connect more closely with providers and with the medical system, but do a lot of like on the ground work out in the community still. So making it very clear that although it exists in the clinic, it's going to exist primarily out in the community. So that's definitely looking forward though.
Good, thank you. Paul?
Well, clearly, in my opinion, you know, the biggest success, if you will, is bringing the Blue Zones project to town. And we're enthused to have our blueprint nearly done. It'll be formally launched in January. But to also see the level of collaboration and cooperation that's come out of the community. I mean, there's just uniform enthusiasm to get engaged. We've got these committees that are functioning with a host of volunteers that become those committed citizens to go out and be fire starters. And really, everyone's very optimistic about this project moving forward, and we're all very excited about it. I will mention a couple of other parallel successes that I think are going on in Klamath Falls. High school graduation rates was a key initiative for us that came out of the Healthy Klamath discussions. And a group called Klamath Promise has come together and enthusiastically approached innovative ways to keep kids in school and to increase the high school graduation rate in our county. And then we also have a project called Klamath Works that is emerging. This is a social services initiative. We recognize that people who are in a state of chronic poverty find themselves in a state of chronic helplessness. And we're trying to break that cycle. And so we've purchased 18 acres in Klamath Falls on which we hope to house essentially all of the social service agencies in town to come together in a collaborative way around a framework of helping people learn new skills and break out of the welfare cycle. It's a philosophy of work for reward, and to help people feel engaged in giving back to the community and also breaking that pattern. And then lastly, I've really got to tout the success of Dr. Van Dyke and the Wellness Center. She's been, for the past year, focusing on the 10% of Sky Lakes employees that are at greatest risk for chronic disease associated with obesity. And in the space of just 1 year, they have accomplished statistically significant decreases in body mass index, total weight, blood pressure, high-risk blood sugar levels, and cholesterol levels. And we're just going to build on that success and keep rolling that out and moving it forward.
Thank you very much. I have 4 seconds. Let me just say the bonus question you didn't get to hear was how do you deal, every community has people who are differently advantaged, disadvantaged. How do you deal with disparities in communities? And what I really appreciated, Alan gave the example of people with disabilities demanding attention. Bianca talked about talking to people and finding out what you thought was their problem wasn't their problem. Paul talked about the fact that people are caught in a cycle of poverty and they have different issues than other people. And Sandra talked about really getting the facts on the ground and knowing what the issues are you're dealing with. And all of you really talked about the Blue Zone folks and the assistance that's brought. What I've heard is you need to get context, you need to get the whole community engaged, then you need to get them involved, you need lots of partners, you need to set goals that are realistic and narrow enough, and you need to just persist. And we all need resources, but I think we all understand there will never be enough resources. But People power is pretty awesome, and you're all good examples of it. Please join me in thanking our panelists. Thank you very much.